All right, Jack. So I know recently one of your family members has been diagnosed with type 2 diabetes. Um, I know you wanted to sit down and talk a little bit about how this whole process worked.
Yeah, it's true. It's kind of something that I got to learn to deal with now and try to help them out, especially because I spend a good amount of time with them. So it'd be good to learn a thing or two.
All right, so we're going to go ahead and hit on type 2 diabetes. So what it is, it's the pancreas is able to supply sufficient amount of insulin for the body. The issue is that glucose is not able to properly get into the cell to give the cell energy. And so the insulin works as a key, and that opens up the cell for the glucose to get into. And so there are some signs and symptoms to look for in regards to type 2 diabetes. This would be things such as being tired, having a sudden weight loss, being always hungry, or having to always urinate. There are some risk factors with type 2 diabetes that include obesity. It is known as a genetic disorder, and if you have a sedentary lifestyle, then you are more likely to have type 2 diabetes. And then we typically look for it for people over the age of 40. And with type 2 diabetes, there are some complications. It can come with, it can bring a high blood pressure. It can bring eye problems or eyesight issues. There can be kind of a hypertension or heart disease due to the thicker blood that's produced from the glucose. There's neuropathy in hands and feet that come along with type 2 diabetes. And another big issue that people face is the kidney disease. So I'm going to go ahead and kind of explain to you how the insulin and glucose works here on the table. And so, if the cameraman can come here. So if you look, insulin works as a key. So the way it would normally work is insulin would go into the cell and it would open up a pathway for the glucose to travel through. The issue is when you have type 2 diabetes, this insulin may be able to come in, but then you might see insulins not be able to fit properly, which means you will just see a whole lot of glucose start forming and building up a lot of pressure in the blood. And so that is really where we see issues. And so the key, which are some treatments, would be something like an insulin pump, which would be able to take the insulin and allow it to fit properly into each of these cells so glucose can more freely move about and create a healthier person overall. So that was a quick rundown of what type 2 diabetes is. I hope it's given you some sort of comfort or knowledge as to being able to take this on with your family member.
I just learned a lot more about type 2 diabetes.